We have some breaking news to bring you from South Carolina. State health officials confirmed 2 patients contracted a new variant that first emerged in South Africa. These are the first 2 cases of the variant in the U.S. Officials say the patients are not connected, and neither patient has a recent travel history. Doctors in the state are asking people to continue wearing their masks and follow COVID protocols. Meanwhile, the CDC says schools are safe to reopen for in-person learning. But several school districts are hesitant to open their doors after nearly a year of online teaching due to COVID-19. 83,000 people have died in January, making it the deadliest month of the pandemic so far. The CDC is warning another 85,000 could die in the next 3 weeks. CBS News correspondent Meg Oliver spoke to several teachers who fear the rise in cases and a lack of sufficient COVID protocols to safely return to class.
The problems persist at vaccination sites nationwide. Long lines, cancellations, and supply shortages. And while President Biden has pledged to speed up the process, his administration's COVID response team is tempering expectations.
It will be months before everyone who wants a vaccine will be able to get one.
FEMA has requested up to 10,000 service members from the Defense Department to help staff as many as 100 vaccination sites nationwide. Part of the Biden administration's COVID response plan is focused on reopening schools, with the goal of getting a majority of K-8 schools safely open in his first 100 days.
100 days to get kids back in school is not quick enough. Schools closed is a national emergency.
Joseph Allen is the director of the Healthy Buildings program at the Harvard School of Public Health.
What's the biggest obstacle schools are facing implementing these guidelines?
Well, I think there's a lot of distrust and confusion from a scientific perspective. It's really quite clear. It really speaks a lot to how our country has deprioritized schools.
And a recent CDC study says there's little evidence for transmission in schools where precautions are met, like mandatory masks, physical distancing, and improved ventilation. But some teachers' unions say school systems do not have these COVID-19 precautions in place for a safe reopening. In Chicago, educators are threatening to strike if the district does not meet their safety demands.
My message to the teachers' unions is we need you guys. If you go on strike, our future is at stake more.
Chicago mom Tamika Hinton is a single parent to 10-year-old Destin. When in-person classes stopped, she cut her work hours to stay home and help her son with virtual learning. With her finances strained, the 2 of them moved in with her grandfather.
I've been hit really, really hard. I had to downsize a lot of different things.
How long can you maintain this?
Not long. Not long.
Joining me now is Dr. John Bradley. Dr. Bradley is the medical director of the Infectious Diseases Division and the Rady Children's Hospital in San Diego. Dr. Bradley, welcome. Thank you for joining us. As you know, there are already several vaccination trials underway for children, an age group not included in the earlier trials of the vaccine. What are scientists hoping to learn from these trials, and how long do you think it will be until there is a vaccine that is safe to administer to children?
So, as you pointed out, the vaccine trials are just getting underway in children. It is usual for the FDA to make sure that that drugs and vaccines are safe and effective in adults before exposing children. And with children, there's an additional issue that after infection, there's a syndrome called MIS-C. That's inflammation secondary to the virus. And we just want to make sure that the vaccines are studied appropriately in children so that we don't see an increase in MIS-C in immunized children. So I think the trials will be going quickly. There will be a lot of attention paid to both effectiveness as well as safety. So I don't expect that there'll be approval or authorization for vaccines for children until the end of the year.
You know, I'm always curious about trials involving children because, of course, they're minors and they need their parents' consent to participate in these trials. What concerns should a parent keep in mind if they are considering including their child in one of these trials?
Every child who goes into a trial will have a complete set of risks and benefits that are provided to the parent so that it's full disclosure. This is required by FDA, NIH, ethics boards, everyone. The benefit is that if a child's protected, that they won't be a source of infection to parents and grandparents, the elderly, people who are at risk in the family. The children themselves will not get such a benefit from the vaccine in terms of decreasing disease compared with adults, where there's huge value in preventing symptomatic disease. Kids, as you know, over half of them when they get infected have no symptoms at all. So it's more of a public health measure to make sure all kids are protected so that they don't spread it to those who are adults in the community who would be at great risk. And rubella immunizations in children are the same way. We immunize children to prevent pregnant women from getting rubella. So, so very important.
Good points. Very important to keep that in mind, for sure. And Doctor, what do we know about the spread of COVID-19 in schools? You know, as you know, there's a big debate raging right now in the Chicago school system where, you know, teachers say we don't feel safe going back into the classroom. The government is saying we need you to go back into the classroom. So how can we make sure the school environment is safe enough that parents feel confident sending their children to school and teachers feel confident going back into the classroom?
That's a great question. And we know we can get kids back to school safely. We know what risk factors there are for spread. We know we can have kids with masks over a certain age. We can limit interactions between kids, both in the classroom and on the playground. The government and each state, especially California, has a plan for getting kids safely back to school. But everyone worries that there'll be an incident where a mask will come off and something will happen. So the teachers are understandably concerned. In California, and I'm sure many other states, as we go through the tiers of immunization, right now we're at 65 and above. The next tier includes teachers. So we're hoping not only to have safe schools so that kids won't spread it and bring it home, but we hope to have immunized teachers so teachers will feel more comfortable going back to the schools, which is really essential. They'll still need to wear masks and protective gear, but if you're immunized, you have this sense of calm that you're not at risk of getting something if you just turn your head for a moment and a child's coughing or sneezing. So both are important.
Yeah, it's so great to hear that that the state is prioritizing teachers, that they're next in line. That's so important. You know, speaking of California, your state, the governor just lifted coronavirus restrictions despite hospitals being so recently overwhelmed. Is there any concern that these hospitals might once again be quickly pushed to the brink before, you know, having the chance to catch their breath?
That is a wonderful question. If people wear masks and do the distancing, stuff that we've been asking for since the spring, then as they lift restrictions, there shouldn't be a spike in new cases and hospitalizations and ICU admissions. It's a big if. There's concern that as the lockdown is lifted, some people will think, well, the virus is gone and I can do anything I want now and stop wearing masks and distancing. So that's the fear. It's theoretical. We'll have to see. But there should be no reason that there would be an increased number of cases and hospitalizations if people follow regular guidelines.
And doctor, officials in the state are also worried about the spread of some of these new COVID-19 variants. What can you tell us about the variant that is spreading throughout California? Is it similar to the one that came from the UK?
Interestingly, there are many new variants that are coming up now, as you know, and California has our own variant. We're looking to see if there's increased contagiousness, increased virulence. So all of the studies that were done for the B.1.1.7 that came out of the UK and are being done in the South African strain are now being done for our California strain, the 246. So, and there's actually evidence that there's yet another strain that's popping up in California. But as we look, we'll find more mutations, and that's been something that we've understood for a long time. But the critical thing is, will the vaccine continue to work? And for every one of these mutants, and the California one is being tested, the vaccine still protects you from infection. The vaccine may not protect you as much as for the original strains that were circulating, but everyone feels confident that there will be substantial protection from the vaccines.
That is good news, because as you point out, the vaccine, it's inevitable that it will mutate. So
yes.
As long as the vaccine can keep up, we're doing okay. All right, well, Dr. John Bradley, thank you so much for joining us. We appreciate it.
Thank you so much for having me.